Have you ever been sitting in a doctor's office and felt like they were speaking a totally different language? I think we've all been there. But what if I told you all that complex medical jargon, it's not a secret language. It's actually a pretty simple code. And today, we're going to crack it.
I mean, you've totally been there, right? You're in the exam room, or maybe you're just watching a medical show on TV, and they start throwing around words like myocardial infarction, hypertension, rhinoplasty, and you're just sitting there thinking, I need a translator. It can feel super intimidating, I get it, but I promise you it's nowhere near as complicated as it sounds.
And see, that's the whole secret right there. It's not a secret language at all. It's a code. A super logical one, actually. It's a system that was built for one reason and one reason only, to be perfectly precise. So in this explainer, we're going to do just that. We're going to crack this code together.
Okay, so first things first, let's dig into what this language actually is and where in the world it even came from. Because this, right here, is the foundation for everything else.
Yeah, so the big takeaway here is that this language was never meant to confuse us, the patients. Not at all. It's actually a standardized tool. Think of it like a universal dictionary that lets a doctor in, say, Tokyo read the notes from a doctor in Toronto and know exactly what's going on. It's all about being incredibly accurate and super efficient.
And here's a really cool little history fact for you. This language, it's not new. It's actually ancient. Most of these terms are built from old Greek and Latin words, and that's what gives them such a solid, consistent foundation. It's the reason why derma will always have something to do with skin, and cardio will always be about the heart.
All right, you ready for the main event? Let's talk about how this code is actually put together. Because it turns out, pretty much every single one of those long, complicated medical terms is just built from 3 simple parts. That's it. Okay, these are your Lego blocks. First up, you've got the prefix. That's the part at the beginning, and it usually tells you something like where, or how many, or when. Then, smack in the middle, you have the root word. This is the star of the show. It's the main idea. And then, at the end, you have the suffix, which typically tells you about a condition, a disease, or maybe a procedure. If you can get a handle on these 3 little parts, you've basically cracked the entire language. Seriously.
Let's actually put this to the test. Take the word cardiology. The root is cardio. That's from the Greek word for heart. The suffix is -logy, which just means the study of. So you put them together, cardiology, the study of the heart. See? Simple. Okay, what about one with a prefix? Let's try tachycardia. The prefix tachy means fast. Cardio is heart, and the suffix -ya just means a condition. So tachycardia is simply the condition of a fast heart. Wild, right? Once you see the pattern, you start seeing it everywhere.
Okay, so now we know how the code works, but let's talk about the why. Why does it have to be so strict? I mean, why is having this shared language so non-negotiable in medicine?
Well, here's why it matters so much. When everyone speaks the same language, you get rid of confusion, and that drastically cuts down on the risk of medical errors. It also means patient records are crystal clear for any doctor or nurse who looks at them, which makes communication between the medical team just seamless. You can think of it as the engine that keeps safe and effective healthcare running.
And we're not just talking about making things run smoothly in an office. This level of precision has a real human impact. I mean, we're talking about a system where one single word, understood correctly, can literally be the difference between life and death.
Just look at the difference here. On one hand, without this shared code, you've got a recipe for disaster, confusion, messy records, and the terrifying chance of getting the diagnosis wrong. But on the other hand, with the code, you get clarity. You get precision. You get a team that works together perfectly. It completely changes the game from, guesswork to an actual science.
So when you boil it all down, what does this all lead to? It leads to a system that we can actually trust. A system that's built, literally, one clear and precise word at a time. And that's really the #1 thing to remember. All those little pieces, the prefixes, the roots, the suffixes, they all have one single, incredibly important job: to create this one unified language that makes sure every single patient gets the safest and best care possible, period. So, from now on, the next time you hear one of those complicated medical terms, I hope you don't feel intimidated. Instead, maybe you can see it for what it really is: a small but vital piece of this amazing, invisible scaffolding that holds up our entire system of modern medicine. Because when you really think about it, it's not just about words. It's about clarity. It's about safety. It's about saving lives. It's so much more than just words, isn't it?